Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million, presented by San Antonio Regional Hospital, here for life. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team. Mitch, Bill, and Sean, I love you guys. And to our special advisory committee that can be found at www.scbrtalk.com/advisory committee. Click on the link and learn about the remarkable leaders doing the work. And of course, I am absolutely thrilled and honored to be sitting alongside two innovative leaders here today. At the helm of San Antonio Regional Hospital in Upland, California, President and CEO John T. Chapman is redefining the future of healthcare in the Inland Empire. Since 2018, Chapman has led the 363-bed San Antonio Regional Hospital through a period of unprecedented transformation. Backed by 500 physicians, 3,000 employees, and over 300 volunteers, his leadership has fueled a financial renaissance, earning repeated bond rating upgrades, even as the industry faced daunting challenges. San Antonio Regional Hospital's achievements, such as the area's only 4-star Medicare ranking and ranking among the nation's top 50 cardiology hospitals, attest to Chapman's relentless pursuit of excellence, earning San Antonio Regional Hospital national recognition. Chapman's vision reaches far beyond hospital walls. As treasurer for the Hospital Association of Southern California Inland Empire Region and chair for the Inland Empire Economic Partnership, he shapes policy and partnerships that impact the entire region. He has pioneered the San Antonio Regional Medical Group, expanded urgent care access, launched new residency programs, and opened a groundbreaking center of aging in Rancho Cucamonga. Most recently, Chapman has championed a regional collaborative to address the urgent mental and addiction crisis facing San Bernardino. A clinical microbiologist by training, Chapman's 2 decades of executive experience include transformative roles at Highland Hospital in Oakland, where he advanced trauma care and modernized facilities, and UCSF Medical Center overseeing major service line. Working alongside Chapman at the innovative Urgent Care Plus facility is Dominique Salido. She is an MSW LCSW, a mission-driven social worker with a decade of experience spanning schools, homes, hospitals, and community mental health. Salido specializes in crisis management, biopsychological assessment, biophysiosocial assessment, and compassionate care, with a focus on older adults and individuals with co-occurring diagnosis. Her patient-centered, strengths-based approach empowers individuals and families, fostering hope, respect, and meaningful progress towards well-being. Together, Chapman and Salido are setting a new standard for integrated, whole-person care, bringing hope, healing, and innovation to the heart of the Inland Empire. John, you have been so busy with the Center of Aging, expanding primary care facilities. And of course, now we are showcasing and happy to announce this new Urgent Care Plus. But before we jump into the discussion, Dominique, you have a decade of experience across diverse environments. What first inspired you to become a licensed clinical social worker and help people struggling with mental health?
Absolutely. So thank you for having me here. You know, I've always had an innate feeling of helping others and helping to advocate for people and also teach people, you know, self-advocacy and empowerment for themselves. So just having that along with training has helped me to pursue even just being here as, you know, San Antonio Regional Hospital's Urgent Care Plus social worker too, and, you know, focusing on the community's needs and mental health.
That's wonderful. And so we definitely need you, and especially at this capacity in a very innovative model, John. What is Urgent Care Plus? And tell us, as the president and CEO at San Antonio Regional Hospital and Behavioral Health Commissioner for San Bernardino County, what behavioral health statistics stand out to you most in our region?
It's just the lack of behavioral health specialists, lack of places that people can go to get treated for behavioral health. You know, in an earlier podcast that we did together, we talked about the dearth of primary care, right? And primary care physicians are not necessarily behavioral health clinicians. Many times they can't treat that, or don't know how, or they want to refer out to a psychologist or a psychiatrist, right? Well, the number of psychologists and psychiatrists are going in the wrong direction, Yvette. In fact, by 2028, San Bernardino is going to lose over 40% of the psychiatrists who are licensed and over 50% of the psychologists. So if someone's in crisis, whether it be from a divorce or any other thing that stresses them on a date, and they have depression or anxiety, where do they go? It's not primary care. Urgent cares don't have it. Maybe they'll go to an ED if they're really suffering major depression or anxiety. So there's no answer. That's why I became a behavioral health commissioner and was appointed by the Board of Supervisors, is to find answers. County can't do it alone. The Department of Behavioral Health Services can't do it alone. It takes partnership with private or nonprofit hospitals like us and other medical groups to find solutions. So we said, hey, let's be creative. What can we do to provide behavioral health services for those who need it with the San Antonio logo? We did two things, and I think we're going to talk about one of the others in a second. But the first one is in our urgent cares. Why not put a wonderful, effective licensed clinical social worker like Dominique to provide that type of service to the community? And I'll tell you already, I've had 3 different hospital systems call me and say, tell me about the Urgent Care Plus model. So we're hoping it spreads. We're hoping it closes that gap where only 52% of people diagnosed with a behavioral health illness, maybe in an ED, or seek and receive treatment. Only half, right?
Wow.
And I think Dominique had told me the other day, she saw a statistic on NAMI where it was 1 in 5 individuals in the U.S. overall in the population have some sort of behavioral health diagnosis, or should have a behavioral health diagnosis, right? So this is our creative, I think, way to benefit the community in San Bernardino County.
Right. So in addition to the decline in psychologists and some of the social workers that are needed to address these challenges, where do you see the other large gaps in behavioral health care, especially for conditions like anxiety, depression, or trauma-related disorders?
Yeah, traditionally, the only place that individuals can go is, again, to a private psychiatrist or psychologist. But if they're not there, the county provides some services, but we all know there's no way the state funds the Department of Behavioral Health to take care of 1 in 5 of our population. When we have, the 7th largest population, if we were a state in the United States, it's not there. In fact, those with diagnosis, only 2% actually get a follow-up. 2% of it get a follow-up appointment. So this is why when patients do go to their primary care, typically they're coming in with a comorbidity. And I'll tell you what we're doing with primary care and behavioral health in a second.
I know we'll get to that, but why is it so urgent to find new resources and solutions for behavioral health in our community?
Well, just morbidity, mortality, and the health of the community, right? I'm sure our clinician here could say, what are some of the symptoms of depression and anxiety? And part of that is not getting health care. So it compounds on itself. You have people who aren't seeking medical help because of their mental health symptoms, and they're not seeking care for diabetes or heart issues or cancer. So when you look at how San Bernardino is doing overall, we're one of the worst counties in the state of California for outcomes for healthcare per 100,000 population. So there's a need. We hope to help fill it.
Hey, Dominique, what are some, well, for those that are new to the topic, right, how would you simply define mental health? And why is it important for everyone? Obviously, in addition to what it is that John expressed, why is it important for people to understand what mental health is?
Absolutely. Yeah, I think just being able to say that mental health is just generally a state of well-being. Essentially, people are able to function with, whether it's work or their relationships. They're able to, have that self-confidence in themselves, feel like they can contribute to the community. So when thoughts, emotions, and behaviors are all in line, and they have that state of mental wellness and overall well-being.
So having a good mental health allows people to have that confidence and to know and feel they have a place in society and their community.
Absolutely. And it's a daily, mental health affects all of us. And so we have helping ourselves to that mental well-being.
Dominique, what are some risk factors that can make people more vulnerable to mental health problems? Are there protective factors that can help?
Mm-hmm. Yeah, that's a great one. So as John was saying, the lack of access to healthcare, maybe a family history or personal history of mental health conditions, substance use, anything related to, poor academics for any age as well, low self-confidence, just being hopeless. Those are all risks that can lead someone to, having more problems in their lives. And the protective factors on the other hand would include having supports, feeling like, they're looking forward to something. They're optimistic about something. They're taking care of their health. They believe in something, and they have access to healthcare, finances, and things like that. So having those in line would essentially allow someone to have less mental health problems in their life.
So how do chronic health issues like poor nutrition or not enough exercise affect someone's mental health? Are there also additional environmental factors that play?
Absolutely. So the poor nutrition and exercise or lack of exercise, that is harmful to someone's mental health and even emotional health as well, because, we know that when we exercise, that's helping us to get the neurotransmitters moving, right? So we have these releases of serotonin and dopamine, and we're feeling good. We could think clearly, make good decisions. It really just impacts our mood overall, and gives us that overall sense of, hey, I'm working out, I'm exercising, like I feel good. And as far as with the eating and our diet, that it goes hand in hand, right? Our diet and how it affects our mood. And if we eat well or we make good choices, it helps us to focus. We can concentrate more in conversation, at work, whatever we need to do.
Now, I have 3 kids, and I always tell them, you are what you eat. So you want to eat something nutritious, something that's got a lot of protein, something that's low in fat and not very processed, right? Because all of those things do have a cumulative impact on our health.
Absolutely. Mm-hmm.
So, John, you mentioned earlier some of the outcome numbers and statistics for the county of San Bernardino, which were not great. So what does county funding for behavioral health typically look like? And how does it help or hinder programs like Urgent Care Plus?
It doesn't hinder programs like Urgent Care Plus because we're partnering with the county, we being nonprofits, private institutions. The county behavioral health department in the state of California receives funds, right, allocated by the governor and the legislature. And what we've seen over the last 5 years, especially now, is a change in focus in behavioral health, and I can talk about that in a second, and a cut in funding. It's not just hospitals are getting cuts in fundings that you've read about and heard so much about on the federal level. It's happening at the state level too.
So, Dominique, when you meet someone for the first time, how do you assess their needs and strengths? What is your approach, especially with older adults?
Mm-hmm. Absolutely. So I would say with anybody that I'm meeting with for the first time, sitting down, talking to them and asking them what their strengths are is really important. Having them highlight that, or if there's family member with them, having the friend share what their strengths are. Also asking them, hey, what is it that you think you need? Sometimes allowing them to identify it for themselves is a good start. And, we also I like to use a lot of assessment tools and short assessment tools, focusing on like a strength-based approach and, highlighting people's strengths to help them to wellness and to, address their, issues. So we can use anything from a patient health questionnaire, PHQ-9 for depression or generalized anxiety disorder, 7, GAD-7, also to kind of just assess the anxiety and depression, and in particular with older adults, it's the mini mental status exam too, so MMSE2, or even just like a clock draw to see where their cognitive state is, and just being able to implement it with that specific population is really important. And from those results, we can see, where they're at, where they score, and then provide some more treatment recommendations from there.
So for someone who isn't sure if they need help, what are some signs that it may be time to reach out for an assessment like the one you mentioned?
Mm-hmm. Absolutely. So typically, the average person has something that works for them. They go about their day with a certain set of knowledge and skills, coping skills. And when they find that that's no longer working as well for them, and there's certain impacts like at their work or occupation, maybe it's school, maybe they're functioning differently in school, activities of daily living, it's hard to manage medical appointments or anything related to that. If they notice that what's working for them is not working as well, then, it might be good for them to consider, coming in and getting help for that.
May I add? Many times when they go to primary care and they're thinking that there is a condition causing their fatigue or insomnia, they don't find anything. And what do primary care physicians do? They tell you it's probably behavioral related. See a provider, but they don't have any mechanism for that wraparound service in primary care yet.
Right. So I'm glad that you segued, because we're going to switch gears a little bit here, because as we know, there's also a well-known shortage of family medicine doctors in the Inland Empire. How does this shortage impact communities, especially for behavioral health? And what efforts has San Antonio Regional Hospital made to address this shortage?
Right. So we can't do it alone, but primary care, when you look at the latest statistics per primary care per 100,000 population, there's a shortage of, ready for this, 33%. That means there is a lack of primary care. How many times have you talked to someone in the community, they're sick, and they say they call, they either can't be part of a primary care panel, they're not accepted, or if they are accepted, they can't see a primary care physician for several days. Hospitals deal with this on a daily basis. When someone leaves the hospital, we expect a follow-up appointment in 48 hours, but their primary care physicians can't see them. So we start our own discharge clinic. Well, now we're doing the same when it comes to primary care. We said, okay, let's be a leader on this. So we started 2 residency programs, ACGME accredited residency programs. We'll be graduating over 20 family physician internal medicine providers per year. But we want them to stay in the community. So we created the San Antonio Regional Medical Group, and we're hiring them. And we're seeding this Inland Empire, especially San Bernardino County, with our Care for You clinics. Now, we're talking about urgent care today, but why is the primary care clinics important? Because we're going to do the same thing that we did here with hiring an LCSW like Dominique. We're putting them in our primary care clinics too. So no longer will our physicians say, you need to see a behavioral health specialist. They're going to say, yeah, you need to see a behavioral health specialist. Let me lead you down the hall. And we'll have one right there.
That is remarkable. Integrated mental and behavioral health specialists to keep that continuum of care flowing. And John, can you tell us how Care for You clinics are expanding and how many you expect to have and at what rate you are hoping to seed them throughout San Bernardino County?
Well, if we're going to be graduating 20 a year, we're hoping to see a lot. Right now, we're up to 4. In 2026, we're opening another 3 to 4. And then these physicians start graduating, right, in 27. So we're looking at doubling. We want Care for You clinics to be the primary of all primary care in San Bernardino County.
Wow. Well, it sounds like you are taking the charge on closing that gap and creating resources, not only for mental and behavioral health at urgent care settings, but also in everyday family medicine needs, which of course we also have a severe shortage in, as we just heard.
It's needed. If you think about it, where do people go then for care? Either they don't get care or they go to the emergency room.
Right.
In a previous episode, we covered emergency rooms, right? And we found out that in the state of California, there's an average of 800 community members touching each ED bay per year. So you think of an ED bay, 800 patients are going to hit that ED bay per year. In San Bernardino County, it's 1,900.
Oh my God.
So you know exactly where the community is going to. Their only chance of care is an ER. We're going to change that.
Wow, that is remarkable. Dominique, what are some of the most common mental health issues you see? Is it depression, anxiety, and what symptoms should people be watching out for?
Absolutely, yeah. So I would say overall, it's pretty common to see depression and anxiety, sometimes both at the same time, sometimes one or the other. But I would say as far as like symptoms go, with depression, it's a lot of difficulty with sleep. Maybe there's a hypersomnia or sleeping longer than you expect to, or issues with diet, or overeating, undereating, concentration, this rumination of thinking about negative thoughts kind of on cycle, and even just reoccurring thoughts also about hurting yourself without a specific plan. So those are just specific symptoms for depression. And the behaviors can lead up to isolation, withdrawal from people, missing appointments, not turning things in, things like that as well. With anxiety, I would say like there's the restlessness, like muscle tension, irritability, and often this idea of, or just even experiencing difficulty with like controlling thoughts. So there's all these, thoughts about the future, what's going to happen. And that can look like, talking pretty fast as well, or you have like, your whole body's tight, or your shoulders are tight or something like that. So those are pretty common issues that I see coming into here at the urgent care, is depression and anxiety.
Okay, well, we heard it here. Depression and anxiety are the primary mental health / behavioral health manifestations that are being treated. And here today at Urgent Care Plus, an urgent care facility provided by San Antonio Regional Hospital. So for everybody listening, Yvette Walker with ABC News and Talk, Southern California Business Report with San Antonio Regional Hospital, unveiling Urgent Care Plus in Ontario, California, an innovative center for all stages of life, treating mental and behavioral health, guided by CEO John Chapman and LCSW Dominique Salido. This groundbreaking program sets a new standard, blending compassionate expertise with visionary leadership to transform community care. One return.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Ontario International Airport is on to a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
This Medical Minute brought to you by San Antonio Regional Hospital, named to U.S. News and World Report's list of best hospitals for heart bypass surgery. The human heart is an amazing muscle. Did you know that it has to beat more than 4,000 times per hour, 100,000 times per day, and 42 million times per year? A healthy heart pumps oxygen to every organ in your body. So show it some love. Join San Antonio Regional Hospital on Thursday, February 12th for a special Valentine's event, Heart to Heart, a conversation on cardiac health. Our expert cardiologists will discuss how menopause can affect heart health, new tools in our state-of-the-art cardiac cath lab, the power of heart CT scans to catch early stages of heart disease, and innovative new therapies to keep your heart healthy. Guests will receive a special Valentine's giveaway. Seating is limited. Visit sarh.org/heart event to book your reservation. San Antonio Regional Hospital. Here for life.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
5-star Etsy favorite with truly unique ingredients. Red wine powder to Korean snow cheese powder, refined and rare. To your personal kitchen to industrial scale. SimplySpiceRubs.com. Elevating every bite. Check out our reviews on Etsy.
Check us out online at KMET1490am.com.
We are the Empire Strikers, the professional sports team of the Inland Empire. We are a fast-actioned and community-inspired pro indoor soccer team. Our mission is to inspire the Empire. Home games, community events, watch parties, and youth camps are all back. Professional indoor soccer is back. Join us and come watch the greatest show on turf at Toyota Arena or on Twitch. Visit www.theempirestrikers.com for more and any information.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Welcome back, everyone. Yvette Walker with ABC News and Talk, Southern California Business Report with San Antonio Regional Hospital unveiling Urgent Care Plus in Ontario, California, an innovative center for all stages of life, treating mental and behavioral health. Guided by CEO John Chapman and LCSW Dominique Salido, this groundbreaking program sets a new standard, blending compassionate expertise with visionary leadership to transform community care. Thank you both so much for being here today. Okay, Dominique, before we hit the break, you were going in depth about some of the symptoms we need to look out for, primarily in depression and anxiety, which are the prevalent manifestations of mental and behavioral health you're finding today. So who is the right candidate for treatment, and what does treatment and support look like at Urgent Care Plus? And how do you connect people with ongoing resources?
Absolutely. So, somebody, trying to see if they're like a good candidate for specifically our services here, it would be someone who is managing well, but they could manage better with whatever it is that they have going on, again, in their daily life. They seem to have maxed out maybe on their coping skills or a certain set of, knowledge or things like that. And that's where they could come in and they can get that education, the psychoeducation on mental health. They can get the assessments here if they're not too sure what exactly it is that is impacting them. We can provide that in the moment support as well as the resources too. They could simply just come in for resources as well. But it's if they, they've noticed that they're just needing a little bit of extra help. And this, sometimes it ends up where they just come to, this session or a meeting here and they feel much better leaving, and then they're able to carry on for themselves.
Perfect. John, how do untreated mental health issues affect the emergency department and the hospital's overall ability to care for patients? You mentioned how most hospitals in California have 800 patients to a bed, whereas at San Antonio Regional Hospital's emergency, you're seeing 1,900.
Right.
How does mental health and behavioral health impact those numbers and the emergency department?
It's difficult. So when we talked about the 1 in 5 population with mental health, that's actually very close to what we're seeing with co-diagnosis of people coming into the ER. Someone could come in with uncontrolled diabetes, but they have a co-diagnosis of, like Dominique was saying, severe depression, anxiety, and then becomes more complex, right? How do, in the ED, they'll take care of the organic cause is, the diabetes, right? They'll get that under control, whether it's an inpatient stay, observation, or they're able to handle it just as an ED visit. But giving them the ability of wraparound services for behavioral health, pretty much non-existent in the emergency room. Really, realistically, the only individuals actually treated in an emergency room for a behavioral health diagnosis are the ones that are brought in by law enforcement that they're a risk to self or others. That's what they put on a 5150. 5150 is basically a code, meaning either the officers or the doctor has required that patient to stay in-house in the ED for 3 days and transferred to an acute psychiatric facility. So EDs and acute psychiatric facilities take care of those most in need, but that's a small percentage when you're thinking 1 in 5 have a need where they're, as Dominique put, they're somewhat stable, but either they could be having a panic attack, they're lonely, they're depressed, it could escalate into something worse. Our goal is to prevent that from happening with an urgent care like this.
So it's kind of obvious, but please reiterate what makes Urgent Care Plus different from traditional urgent care or behavioral health programs. Oh,
what's beautiful about this is there are very little private urgent cares where they take care of your behavioral health needs. There are waiting lists to get into county behavioral health departments. And there's a lack of psychologists and psychiatrists. Yeah, I'm painting a bleak picture, but that's what it is. That's why there's so many people not being seen who've either been diagnosed with behavioral health issues in the past for an ED, an inpatient stay, and they're not getting the help they need. In fact, a statistic here, people in the US who receive treatment each year, 70% of the people diagnosed with a mental health need don't continue their treatment because of lack of resources. 70. Think about that.
Yeah.
2/3.
Devastating. It really is, especially when it's a lack of resources, not necessarily a lack of wanting to have treatment.
Right. And what's good to talk about this, I'm sure your listeners have a loved one, could be themselves, a loved one, someone they know. Everybody knows someone who's suffering through some type of crisis at least one time in their life.
And as Dominique mentioned, and you mentioned, it could come in the form of a divorce, of having to be relocated or have a transition in job or in life, being an empty nester, so many different things in life that can prompt these mental and behavioral health challenges.
And you heard Dominique talk about support. That's probably what's lacking for many of those without behavioral health. They don't have support. They're lonely. They're facing it alone. Being able to talk to a licensed clinical social worker like Dominique is basically a form of therapy. They come here to talk out because they have nobody else. She can give them great advice. In fact, what we also do, if needed, is if we transition them to a behavioral health specialist and they need 2 or 3 days of something that calms them for anxiety, our urgent care doctors can do that.
Right. I can see this being a tremendous resource, even also in addition to mothers that are suffering from postpartum depression, right? You have a hospital, you have a wonderful maternity unit, and just so many facets to the hospital with that continuum of care that can segue patients into the proper area.
And especially for seniors too. She's an expert in senior care. And what's the highest growing population in the Inland Empire?
Senior population.
Seniors. That's why we're opening a center of aging in Rancho. So being able to serve that community, as well as the community at large, is just blessing upon blessing.
Absolutely. So Dominique, how does working with people from many different backgrounds and ages help you provide better care in a setting like Urgent Care Plus?
Absolutely. So, working with different cultures and different ages and different issues, different everything, I've been able to learn a lot from people, and what they share with me, and I'm able to, learn also a lot of common issues that people come in for, and I'm able to, fine tune my assessments with them as well, and really get them connected to the appropriate, resource that they need, or provide the right treatment recommendation for them as well.
So I know you have a broad experience with the elder population. What are some of the common things that they encounter?
Yeah, absolutely. That's a great question too. There's so many, baby boomers that are aging, and there's a lot of people who are trying to support their loved one who is aging as well. So as far as for what we're seeing with older adults, it's a lot of, medical conditions, their adjustment with, a lot of loss, whether that's the loss of like their home, or the loss of a partner, or the loss of a pet, the loss of what they thought their life was going to be like at that age. So a lot of just transitions, a lot of financial stressors as well, and even just adjustments with their own medical conditions too can be really difficult. I thought I was going to be here, or I just got this diagnosis and I don't know how to, what to do for it. Or I'm lonely. That's another thing, especially with the pandemic and all, there's just this disconnect of older adults and lots of isolation going on. They want to connect, they want to chat, they want to have a group to go to, or, someone to listen to them. So there's a lot of challenges with isolation and loneliness too.
I can imagine. So with the Center of Aging coming online very soon, how do you view that as a resource for patients that are coming in of the older population that are saying, I got this diagnosis and I don't know how I'm going to be able to treat myself or have, access to getting to and from my appointments? Mm-hmm. How do you see the Center of Aging with the plan and the model to have transportation for patients within a certain radius to come in and, hopefully overcome some of the depression that comes with at least that part of?
Yes, it's amazing. I'm so excited. It's going to make all the difference, because transportation is a huge issue as well. Lack of access to certain technology as well. But just be able to get their services in a general area and have that transportation to get there, instead of, I missed my appointment because my ride didn't come, or I can't pay for the bus fare, or, something flared up, so having that's going to be a huge change for the community, and a positive one. So I'm really excited.
Wonderful. So John, as a behavioral health commissioner, what trends or new challenges is the county seeing right now?
They're seeing a change in focus based on new state mandates. They're going from an MHSA to a different focus altogether. The biggest change is, in the past, there was funding for preventative care. No longer. It's been taken away. Preventative care is no longer part of the scope of behavioral health, which is right. The idea is to keep them out of depression, out of anxiety, not getting diagnosed, providing a type of service or need taken care of before it gets to that point, right? There's another statistic that I share that's scary. It's the average delay between onset of mental illness symptoms and treatment is, want to take a guess how many years?
Oh my goodness, 3?
11.
Oh my goodness.
So imagine somebody going through that. They could have had 11 years of their lives back or better.
Oh my God.
So don't you agree? Preventative care is definitely necessary. And that's why I want individuals who may not know if they have a behavioral or a mental health illness. Don't be stigmatized by the idea of coming to and seeing a behavioral health specialist. You may be bettering your life by doing so, and all you may need is some cognitive therapy, a talk with Dominique. Mm-hmm. So we're looking to get the education and the providers to be able to handle our care.
Absolutely. Like you said, a talk with Dominique, and one of the things that you mentioned was loneliness. Sometimes people just want someone to talk to, someone that knows that they're being heard and have a compassionate ear to give them some advice or positive affirmation, right? And so this in itself is a great way to do that.
And we provide wraparound services. So Dominique will have that talk and say, hey, by the way, here's somebody who may be able to see you routinely that's in your community.
Absolutely. So John, what are other organizations and institutions doing in this field? And why is it so important to foster public-private partnerships to address behavioral health challenges together?
I think you heard the theme I'm giving. Public health can't do it by themselves, right? Private institutions need to take part in this. And there's a number of ways to pay for this. People say, oh, well, we can't do it. For those out there, if you have primary care, guarantee you, your primary care physician, if you have depression, anxiety going on besides something else that you're seeing your doctor for, those physicians typically only have about 20 minutes to see you. It takes probably 45 minutes to an hour to even address the behavioral health aspect. So what happens is a clinic can't see as many patients as they can. So what we do and how we're able to pay for it, we're saying, you'll see your doctor for those 15 or 20 minutes. Then we're going to send you to an expert who can help you with your behavioral health concerns. More throughput, more patients being seen, reimbursement takes care of itself, and you serve the community. It's a win-win-win. And I mentioned earlier before we started this podcast, we had 3 health systems come to us and say, how are you doing this? How are you financing it? How does it work?
Right.
And they're taking note.
That's a wonderful, promising sign that this is a model that can be duplicated and hopefully multiplied across the board, because as you mentioned, there's a tremendous need and a tremendous open, gaping gap that needs to be filled. So Dominique, tell us again a little bit about prevention and early education, how that can help people stay mentally healthy.
Yes, as John was saying, prevention and early intervention is everything. It's important, especially with mental health, to give that education to people so that they know what to look out for. They know what to expect should they decide to pursue any type of treatment related to their mental health conditions. It allows them to work with their provider and the provider to work with them well, because they are on the same page with that information and education. Also the early intervention and just, giving that information to the community and individuals and whoever else also helps to destigmatize mental health too, and just explain really what it is and give certain medical term or mental health terminology to, what it is that they're experiencing, and they can build more empathy for those around them, for the community, for a family member, for themselves. They can, when they have that education, they can understand themselves better, and then also build empathy and compassion for those around. So it's really important to have, preventative and early intervention, especially when it comes to mental and behavioral health.
Well, you're clearly an empathetic and compassionate person, Dominique. How does it make you feel to know that you can be in that place at that time to help that person reach, a level of mental health and well-being that will enhance their quality of life and connect them to those resources that are critical to being successful?
Absolutely. So, it means everything to me to be able to help someone, even if it's just one person. Because there's this domino effect of, other people, saying, hey, you can get help as well, or this is what I learned, or they share it with someone. But it just means everything to me to know that I can help someone, even just bring some relief to their daily life, or give them that piece of the puzzle. And also for them too, to empower them to also find things that work for them so that they can do it on their own, when they're no longer here sitting with me. They can be independent on their own, and I can, come up with a solution, or this is what I was taught, so I'm going to apply it at this time. And they're able to function in that way.
So what are some basic techniques that we can leave with the audience today for something like anxiety that you would tell a patient as you're examining them, just as coping mechanisms or approaches to overcoming some of those anxiety issues?
Yeah, absolutely. So I'd say maybe one that I really like is imagery. So it can help with anxiety, it can help with depression as well, but just taking yourself, even, finding a safe and quiet place. You may keeping the lights off or on, however you feel, sitting comfortably and just closing your eyes and thinking about a place that makes you feel happy and safe, and really just going through every single sense of that. Like, what do you hear? What's the temperature? What does it smell like? What can you feel? Can you feel anything? Is it cold? Is there water around? Are you wearing a fuzzy jacket or something? So just having them walk through that as well. And that's, all in all supposed to help them, feel connected to themselves and help them like cope with what they're going through at that time.
Remarkable. So to everyone listening to this message, whether a patient, provider, or partnering organization, what words of encouragement would you like to share about the possibilities that arise from integrating innovation and medicine to treat mental and behavioral health conditions, specifically at Urgent Care Plus?
Yeah, so what I would say is, keep an open mind about coming. We want to be able to support, and we're really excited to be able to provide the services here in a holistic way, and serve whoever comes in. So.
Very good. And John, the same question to everyone listening, whether a patient, provider, or partnering organization. What words of encouragement would you like to share about the possibilities that stem from integrating innovation and medicine to treat mental health and behavioral health conditions, particularly under the model of Urgent Care Plus?
I'll put my behavioral health commissioner hat on for this one.
Okay.
When I'm sitting in these meetings with hundreds of individuals who are actually seeking treatment or in treatment, what they want to hear is help is on the way. And it starts here today with our Urgent Care Plus, at least for San Antonio Regional Hospital, assisting with this concern of too many people going without care.
Okay, well, thank you both so much for that insightful discussion, for your work, for your innovation, for your vision, and for your heart for the community, really, because the status quo isn't working. And it seems like too many organizations or entities either lack the vision or are okay with the status quo, or don't really recognize the true impact that is occurring within our communities as a result of lack of resources and access to mental and behavioral health resources. So thank you for your part. Thank you for continuing to grow and charge this effort. Thank you for being a model in our region and across the state. It's really exciting to see what's happening here at San Antonio Regional Hospital and Urgent Care Plus. I look forward to following your work and exploring future sites that are only going to be growing. All right, for everybody listening, don't forget to find us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. And don't miss my conversation with Stig Laniskog, CEO of the Claremont College's Services, uniting 7 renowned colleges through visionary leadership and strategic collaboration. With decades of experience in academia and consulting, he fuels innovation, supports over 8,000 students and 3,400 staff, and advances the legacy of excellence at the Claremont Colleges. Next week, we will have Linda Wilson Dominguez, Chief of Community Partnerships for Girl Scouts of San Gorgonio, transforming lives by forging vital connections for underserved youth. Inspired by her migrant roots, she champions access, equity, and resilience, empowering girls to thrive through courage, character, and confidence. One dream, one partnership, one community at a time. You do not want to miss it. We will see you all next week.